Hello friends, welcome back to Expert Medical Coding. In this video, we'll continue with the ICD-10-CM Chapter Specific Guidelines from Chapter 1, Part 2. This section focuses on two very important topics, and they are how to code infectious agents as a cause of diseases that are classified to other chapters, and how to handle infections that are resistant to antibiotics. First, let's go through the official guideline. After that, I'll break it down into simple explanation with easy to follow examples. So let's begin with the first guideline that says infectious agents as the cause of diseases classified to other chapters. Certain infections are classified in chapters other than chapter 1 and no organism is identified as part of the infection code. In these instances, it is necessary to use an additional code from chapter 1 to identify the organism. A code from category B95, that is Streptococcus, Staphylococcus, Enterococcus, as the cause of the diseases classified to other chapters. Category B96, other bacterial agents as the cause of diseases classified to other chapters, or category B97, viral agents as the cause of diseases classified to other chapters, is to be used as an additional code to identify the organism. An instructional note will be found at the infection code advising that an additional organism code is required. Now that we have read the guideline, let's simplify it step by step with examples. Sometimes certain infections are found in other chapters of ICD-10-CM. For example, pneumonia is coded in Chapter 10, Diseases of the Respiratory System, not in Chapter 1. If the physician documents pneumonia with the organism and a combination code exists, assign that one combination code. Example, J15.4, pneumonia due to other streptococci. This already includes the organism, so no extra code from category B95 to B97 is needed. But if a combination code does not exist, then you must use two separate codes, one for the infection and one from the category B95 to B97 to identify the organism. Let us see an example now. Cystitis due to E. coli. Cystitis code is in Chapter 14, Genitourinary System, and the code is N30.90. But N30.90 doesn't say which organism caused it. Doctor mentioned E. coli, so we have to use that code separately, and the code is B96.20. So final codes will be, two codes will come here, one for the infection, that is N30.90, and another one is for the organism, that is B96.20. This way you have two codes, the main code for the disease like pneumonia, cystitis, meningitis, etc., an additional code from category from B95 to B97 to show the organism that caused it. Let's move to the next coding guideline, which says infections resistant to antibiotics. Many bacterial infections are resistant to current antibiotics. It is necessary to identify all infections documented as antibiotic resistant. Assign a code from category Z16, resistance to antimicrobial drugs, following the infection code only if the infection code does not identify drug resistance. Now let's understand this in a better way. Sometimes the bacteria that causes an infection do not respond to regular antibiotics. This is called antibiotic resistance. In ICD-10-CM, we must show this by adding an extra code. Use a code from category Z16, resistance to antimicrobial drugs. But remember, first code the infection, then add the Z16 code only if the infection code itself does not already mention resistance. Let us see an example. Patient has UTI due to E. coli, resistant to penicillin, is documented by provider. So first you have to code for the UTI. UTI code will be N39.0, urinary tract infection, site not specified. Then you have to code the organism, B96.20, E. coli as the cause of diseases classified elsewhere, and then Z16.11, resistance to penicillins we have to code. So finally we'll get three codes here, one for the infection, N39.0, second one is for the organism, B96.20, third for the resistance to penicillins, Z16.11. Let us see another example. Patient has pneumonia due to MRSA, that is methicillin resistant Staphylococcus aureus. So here main pneumonia code will be only one code because we have a combination code here, that is J15.212, pneumonia due to MRSA. This code already says resistant, so we don't need Z16 here. So finally we have to code only one code because we have a combination here, and the code will be J15.212 only. Please like, share and subscribe to Expert Medical Coding. Thanks for watching.